From this month, adults in Germany can legally possess and consume certain amounts of cannabis. While opinions on this development vary, it's widely acknowledged that cannabis can pose potential health risks. Hajar Zebek and colleagues at the Ibn Sina University Hospital in Rabat, Morocco, have highlighted a potential complication of recreational cannabis use based on the case history of a young man. A 24-year-old man was admitted to the clinic in Rabat experiencing status epilepticus. He reported a daily consumption of 8 to 10 cannabis joints since the age of 18 years, with no use of alcohol or tobacco. Cannabis contains two psychoactive components, delta-9 tetrahydrocannabinol and cannabidiol, both of which target type 1 cannabinoid receptors found in the neural endings of several brain regions, including the hippocampus. This clarifies the involvement of the hippocampus in the case of the young patient. Excessive cannabis use can lead to acute bilateral hippocampal lesions, as observed on FLAIR and diffusion sequences of MRI. In the case of the 24-year-old patient, other potential causes of bilateral hippocampal lesions, such as herpes encephalitis and autoimmune encephalitis, were ruled out. A few years ago, French neurologists led by Laurent Claret de Langevant from Assistance Publique Hôpitaux de Paris, CHU Henri Mondor, France, highlighted the risk of acute hippocampal encephalopathy in heavy cannabis users. Cannabis is the most commonly used drug in Europe, according to Lars Wilhelm and Professor Jan Kramer and colleagues from LADR GmbH Medical Care Center in Geesthacht, Germany, as outlined in a journal article on the drug's toxicology. Approximately 60% of the nearly 80 million consumers are male. Lifetime prevalence of cannabis use in Europe varies widely, ranging from 4% in Malta to 45% in France. Cannabis-related offenses dominate drug-related crimes, with 57% of trafficking offenses related to cannabis. The consumption patterns among today's youth suggest a continued increase in the recreational use of cannabis as a narcotic drug. In addition to the desired intoxicating effect of cannabis, undesirable effects also occur. These include impaired cognitive performance, particularly affecting memory, attention, and psychomotor skills. Regular use has been observed to lead to a drop of 8 IQ points. However, cognitive restrictions are usually no longer detectable after prolonged abstinence. Furthermore, structural changes in brain regions with high CB1 receptor density, such as the amygdala and hippocampus, have been demonstrated.